Hey everyone, it's Tony from Retirees Benefits here. So as 2026 approaches, I need to talk to you about something that's catching a lot of people off guard. Medicare leaves out some major health needs. And I'm talking about things like vision, dental, and hearing care, plus a couple of other big gaps that most people don't even realize exist. And here's the kicker. The price tag for these gaps can easily reach thousands of dollars a year. If you're living on a fixed income, these uncovered costs can make the difference between peace of mind and real financial stress. Now, I spent the last few days reading through all the official Medicare guidelines and policy updates for 2026. And honestly, it's confusing. So I read all of it so you don't have to. And I'm going to break down the 5 biggest things Medicare still won't cover in 2026. And more importantly, what you can actually do about it. All right. So what's the goal here? I want you to walk away knowing exactly what Medicare won't pay for in 2026, who's most affected, and what your backup options are. Whether you're already on Medicare, about to turn 65, or helping a parent navigate this system, this information could save you thousands of dollars. Number 1. Medicare still doesn't cover routine vision care in 2026. Original Medicare doesn't cover routine eye exams, glasses, or contact lenses. The only exception is if you've had cataract surgery, then you're allowed one pair of glasses or contacts after the procedure. That's it. So if you just want your yearly eye checkup or you need a new prescription for glasses, Medicare won't pay for it, and these costs add up quickly. A basic eye exam can run anywhere from $100 to $250. Prescription glasses can easily cost several hundred more. If you prefer contacts, that can be another $200 to $300 per year. Who this hits hardest? Anyone over 65 because our eyes change as we age. This is especially tough for people with diabetes who need regular screenings, or seniors on fixed incomes who can't afford surprise vision costs. What Medicare does cover? Only medically necessary exams, like screenings for glaucoma if you're at high risk, or diabetic retinopathy checks if you have diabetes. What you can do. Some Medicare Advantage plans include vision benefits, but they're often limited. They might give you an annual allowance for eyewear, usually capped around $150 to $200. That rarely covers the full price, especially if you need progressive lenses. Also, shop around. Look at retailers like Costco, Walmart, or online companies like Zenni Optical. I'm talking $30 to $100 instead of $300 to $500 for glasses. And check out Lions Clubs International and New Eyes for the Needy. Both have programs that provide free or low-cost glasses to people who qualify. Number 2. Hearing aids. This is one of the most expensive gaps. Original Medicare still does not cover hearing aids or the exams needed to fit them. What Medicare will cover are diagnostic tests if your doctor orders them to investigate a hearing or balance problem. But the devices themselves and the fitting process? That's all on you. Hearing aids often range between $2,000 and $6,000 per pair. And since most people need 2, that can mean thousands out of pocket every few years. Plus, hearing aids typically need to be replaced every 5 to 7 years, so this becomes a recurring expense. Who this impacts? About 1 in 3 people over 65 have some hearing loss. An untreated hearing loss is linked to depression, social isolation, and even cognitive decline. So this isn't just an inconvenience, it's a real health issue. What you can do. There has been progress with over-the-counter hearing aids, which became available in 2022. These can be purchased directly at pharmacies or big box stores, and they're often less expensive, sometimes as low as $800 to $1,000 a pair. That's still not cheap, but it's significantly less than traditional devices. The important point is that even though OTC hearing aids exist, Medicare still doesn't pay for them. Some Medicare Advantage plans do offer hearing benefits, but those benefits vary widely. Some will cover a few $100s toward a device, while others might offer discounts. It's critical to read the plan details before assuming you're covered. And veterans, if you get care through the VA, they often provide hearing aids at low or no cost. Check with your local VA facility. Number 3. Dental care. And this catches a lot of people off guard. Medicare does not cover routine dental services. That means cleanings, fillings, extractions, dentures, implants, and root canals. All of that falls outside of original Medicare coverage. The only exception is if the dental service is medically necessary as part of another treatment. For example, dental clearance before an organ transplant, dental exams before a heart valve replacement, or oral surgery related to certain head and neck cancers. CMS has expanded these scenarios slightly in recent years, but they're still rare. For most people, though, the everyday dental care we all need, like regular checkups or replacing dentures, remains excluded. A basic cleaning might cost $100 to $200. A filling can be $150 or more. And a single dental implant can run $3,000 to $5,000. Without coverage, these expenses hit hard, especially for retirees on fixed incomes. Who this affects? Pretty much everyone on Medicare. Oral health is connected to overall health, especially for people with diabetes, heart disease, or chronic conditions. What you can do. Some Medicare Advantage plans advertise dental benefits, but they usually come with caps. Most plans cover up to $1,000, or $1, $500 a year. That may sound helpful, but a couple of crowns or implants can burn through that amount very quickly. Also look into dental discount plans. These aren't insurance, but you pay an annual fee and get discounts at participating dentists, sometimes 20 to 60% off. And check out community health centers in your area. Many offer dental services on a sliding scale based on income. Number 4, and this is probably the most serious gap, long-term custodial care. Medicare does not cover long-term custodial care. That means if you need ongoing help with activities like bathing, dressing, or eating, or if you need to move into a nursing home or assisted living facility for non-medical reasons, Medicare won't pay for it. What Medicare does cover is short-term skilled nursing care after a hospital stay, but even that is limited. Typically, you must have been hospitalized for at least 3 days to qualify, and coverage is capped. Medicare will pay in full for the first 20 days. Then you pay a daily coinsurance from days 21 through 100. After day 100, you're responsible for the full cost, and we're talking serious money here. The average cost of a private nursing home room in the U.S. is about $100,000 per year. Assisted living often runs $50,000 or more annually. These costs can quickly wipe out savings, especially for people who need care for multiple years. Who this affects? Anyone aging in place, people with Alzheimer's or dementia, stroke survivors, people with severe disabilities. About 70% of people over 65 will need some form of long-term care in their lifetime. What you can do, the only major safety net here is Medicaid, but that requires you to meet strict income and asset limits to qualify. You essentially have to spend down your savings to become eligible. Another option is to plan ahead with long-term care insurance or hybrid life insurance policies that include long-term care riders, but those are best purchased earlier in life when premiums are more affordable. Also look into PACE programs, Program of All-Inclusive Care for the Elderly. These coordinate all your care, including long-term services. And veterans, check the Veterans Aid and Attendance Benefit. If you're a veteran or surviving spouse, you might qualify for extra money to help pay for care. Number 5, and this one confuses a lot of people, traditional annual physicals. Medicare does not cover a traditional full head-to-toe physical exam with routine lab work. What Medicare does cover is a Welcome to Medicare visit in your first year and yearly wellness visits after that. These wellness visits are focused on preventative care. They include things like reviewing your medical history, checking vital signs, updating your list of medications, and discussing your risk factors. They are important, but they are not the same as a comprehensive physical. If you ask your doctor for a full physical with blood tests, you may get a bill unless there's a specific medical reason for those tests. This catches many people off guard because they assume annual physical means what they grew up with: blood work, screenings, and a full exam. Under Medicare, unless those services are tied to a diagnosis or risk factor, they aren't covered. What you can do, you need to be very specific when scheduling. If you want the no-cost preventative benefit, make sure to ask for your annual wellness visit. Use those exact words. Don't say annual physical, or you might end up with a bill you weren't expecting. Okay, so I know that was a lot of bad news. But there are actually some new changes in 2026 that could save you money. First, Medicare Part D will have an out-of-pocket cap of $2,100 in 2026, up from $2,000 the year before. The good news is, you'll still have the option to spread those costs out with a monthly payment plan instead of paying all at once. Second, every ACIP-recommended adult vaccine remains free under Medicare Part D. That includes shingles, pneumonia, flu shots, and more. Third, the $35 monthly insulin cap continues in 2026, which is especially important for those managing diabetes on a limited budget. And fourth, dental coverage is expanding just a little, but only in very specific medical situations like organ transplants or heart valve surgery. Routine care like cleanings and dentures is still excluded. Listen, I know navigating Medicare can feel overwhelming. The rules are complicated, the costs add up, and sometimes it feels like the system is designed to be confusing. But you are not alone in this. There are resources, there are programs, and there are people, like me, who want to help you make sense of it all. So which of these uncovered costs in 2026 worries you the most? Is it vision, dental, hearing, long-term care, or something else entirely? Drop your thoughts in the comments because I read every single one, and your experiences help others watching too. If you found this video helpful, hit the like button so more people can see it. Make sure to subscribe for more updates on Medicare, Social Security, and the financial issues that matter most to you. You've got this. And I'll see you in the next one.